Under eye filler is a very common area of concern for both men and women. Often we look tired when we don't feel tired, and this gives us the appearance of having an under eye bag or dark circles around the eyes. Filler can be used very well to camouflage the dark circles under the eye and make you look more awake and more lively. There are two ways to perform fillers underneath the eyes, also known as the tear troughs. One utilizes a traditional needle approach. The second utilizes a blunt tip instrument known as a cannula. The advantage of the needle is more precision, but also more pain, and it's not advisable to use needles that close to the eye. The advantage of the cannula is because it's blunt tip, it cannot shear through blood vessels or nerves. Also, it's much safer around the eye, and a distant approach site can be used. This way you don't have to keep poking your patient. It's much more comfortable. I employ the cannula technique when I fill the tear troughs. Here, what we do is we find a very appropriate area to insert our pilot needle. A small bleb of anesthesia is put in at the pilot needle insertion site. After the pilot needle insertion site is appropriately numbed, the introducer needle is then penetrated through the skin. Only a small stab incision is made, and then the blunt tip cannula is inserted through this hole, and the filling process starts. It is a much more comfortable procedure for our patient. Oftentimes, your doctor may put his finger on the bone to ensure the placement of the cannula is correct and to make sure that the cannula is not going into the orbital area. This is a pretty benign procedure and can be completed in a few minutes. Even with the cannula, it is possible to get a significant amount of swelling and bruising around this area, so it's important not to do this procedure when you have active social plans. Oftentimes, the area around the eyes are very sensitive, and even placing a very thin filler in that area can absorb some water and create more swelling. This does not occur in most people, but when it does, usually comes down in a week or so.